Hello everyone, let's start our tutorial on the anatomy of the urinary bladder. And we know that it is a muscular reservoir found in the anterior part of the pelvic cavity, as you can see labeled in this particular image. Now the size, the shape and the position of the bladder is variable depending on the amount of urine present. When it is empty, it is present entirely within the pelvic cavity, but when it is filled, the bladder expands and it also extends superiorly into the abdominal cavity. Above there's the abdominal cavity, then there's a demarcation, the pelvic brim, and then there's a pelvic cavity. This is something that can be asked quite easily in a viva, right? And when it is filled to the maximum, it can even reach up to the umbilicus. Now let's consider the external features. So when we consider an empty bladder, we say that it is tetrahedral in shape, meaning it has 4 sides, because tetra obviously means 4. So it has an apex, and you can see the apex labeled, and the apex is directed forwards, यानी apex सामने की तरफ directed होता है. So this is the apex and it is directed forwards. Then we have the base, which we cannot quite see in this image because it is directed posteriorly, यानी पीछे की तरफ. Then there is also the neck, and this is the lowest, meaning the most inferior, and also the neck happens to be the most fixed part of the bladder. This is something that can most likely come in an MCQ, which is the most fixed part of the bladder, and the answer to this is the neck of the bladder. Now the bladder also has a total of 3 surfaces. My apologies, a total of 3 surfaces. And in these surfaces, obviously we consider neither the apex nor the base. Those are separate. So we have the superior surface, which is facing upwards, as you can see, and 2 infralateral surfaces. We can only see one infralateral surface because of the fact that we are looking at the bladder from the side, but there are in fact 2. One that is towards the right and the other that is towards the left. Now this is for the case of the empty bladder. In the case of a full bladder, the shape changes from tetrahedral, possessing an apex, a base, a superior and 2 infralateral surfaces, to an ovoid shape. Now the ovoid shape also has an apex, but the apex does not point forwards, rather it is pointing upwards towards the umbilicus. There is still a neck that is directed downwards in the ovoid called urinary bladder, but now there are 2 surfaces, one facing forwards, the anterior surface, and one facing backwards, which is the posterior surface. Right, so I'm hoping this makes sense. Now let's talk about the various important relations of the urinary bladder. Now the first important relation is the relation of the apex. Now the apex, which we said is directed forwards, is connected to the umbilicus, which is a landmark on the anterior abdominal surface, and it is attached by a ligament known as the median umbilical ligament. So the apex of the urinary bladder is attached to the umbilicus via the median umbilical ligament. In this image, you can quite clearly see the median umbilical ligament. Now we'll talk about the relations of the base now in this sagittal section, because we've already said the base is facing backwards. So which is the base? This over here is the base, and the relations are different in the male and in the female, and this is for the male. In the female, it is the upper part of the base, meaning the superior part of the base, is separated from the rectum by a pouch known as a rectovesical pouch. Now the question is, why is it known as a rectovesical pouch? Because it is found between the rectum and the urinary bladder, and therefore it is termed as a rectovesical pouch. So the upper part of the base of the urinary bladder in the male is separated from the rectum by the rectovesical pouch, right? And this part of the rectovesical pouch also contains the coils of the intestine. Convenient. Now, the lower part of the base in the male is related to the seminal vesicle and also to the termination of the vas deferens, so that's interesting. So, the lower part of the base is related to the seminal vesicle, represented here in orange, and also to the termination of the vas deferens, which is labeled over here. So, now these are the relations of the base in the male, and this is a view of the urinary bladder of the male, the base of the urinary bladder of the male, and you can see the relations quite clearly. It is said that the upper part of the base is covered by the peritoneum, obviously because of the rectovesical pouch, which separates it from the rectum. The lower part is related to the seminal vesicle, shown over here. My apologies, to the seminal vesicle and to the termination of the vas deferens. This is the vas deferens, and the terminal part of the vas deferens is dilated and known as the ampulla of the vas deferens. So the upper part, as you can see, is related to the rectovesical pouch. The lower part is related to the seminal vesicle in the male and to the vas deferens in the male. Now let's talk about in the female. Right, in this image, let's see if we can so this is a sagittal section of the female pelvis, and in front you can see quite easily the urinary bladder, and this over here you can see is the uterus. This is the cervix, this part is the vagina. So, and in the female, the base is related to the uterine cervix and to the vagina, and that does make absolute sense, because this is the uterine cervix and this is the vagina, my apologies, and this is the vagina, and so these two structures are related to the base of the urinary bladder in the female, and this is not that hard at all. So I'm hoping this makes sense. So we're done with the relations of the apex, which are the same in both the male and the female, being the median umbilical ligament, which connects the apex to the umbilical ligament, the base, which in the male is related in the upper part to the rectovesical pouch, which separates the base from the bladder, lower down to the seminal vesicle and the termination of the vas deferens, better seen in this image over here. Now let's talk about the neck. Let's reiterate a couple of facts. The neck is the lowest as well as the most fixed part of the bladder. Now, what is its location? It is located 3 to 4 centimeters behind the lower part of the pubic symphysis. Right? And in this image over here, we can see the general location of the pubic symphysis. Better over here. Right? So it is located, the neck is located 3 to 4 centimeters behind the lower border of the pubic symphysis. And over here you can see this is the lower border of the pubic symphysis, and 3 to 4 centimeters behind it is located the neck of the bladder, a little above the plane of the pelvic outlet. Now it is obviously pierced by the internal urethral orifice. Now let's talk about the relations in the male and then in the female. In the male, the neck is surrounded. So these are the frontal sections above of the female and this one below of the male. As you can see, the label line. Now the neck of the bladder has basically been represented over here, and you can see the label line. So this part is the neck of the bladder, and it is pierced by the internal urethral orifice. So now, since we're talking about in the male, right, in the male, smooth muscle bundles, they surround the bladder neck, and they also surround the pre-prostatic urethra, the part of the urethra above the prostate. This is the prostate, right? And these are arranged in as a distinct circular collar, right? And these fibers, these muscle fibers, have their distinct innervation, their distinct adrenergic sort of innervation, and you can see them represented over here. Internal urethral sphincter muscle, okay? And this is also known as, in addition to the internal sphincter mechanism, this is also known as the pre-prostatic sphincter because it is above the prostate. It does not have any parasympathetic cholinergic innervation, only adrenergic. It is said to be part of the proximal urethral sphincter mechanism. So this is the relation in the male. What about in the female? In the female, the neck portion, as you can see represented, is supposedly related to the pelvic fascia, which surrounds the upper part of the urethra. The pelvic fascia or the vesical fascia is said to surround the upper part of the neck of the bladder, and that is an obvious thing, nothing too difficult. Right, now let's talk about the superior surface. Again, the relations are different in the male as well as in the female. Right, in the male, it is completely covered by the peritoneum and is in contact with the sigmoid colon and with the coils of the terminal ileum. So this is a representation of the male urinary bladder, and in green is represented the peritoneum, and you can see the whole of the superior surface is covered by the peritoneum, and above that you can see the terminal ileum, and you can see the coils of the terminal ileum, and you can see the sigmoid colon. In the females, the peritoneum does cover the greater part of the superior surface, but a small area is devoid of peritoneum, right? And this small area is near the posterior border. Now you also have to realize that there are 4 borders of the urinary bladder. There are 2 lateral, a posterior, and 1 anterior. For this, let me just use this. This is the posterior border. Here are the 2 lateral borders, and this is the, my apologies, and this is the anterior border. So near the posterior border, part of the superior surface is devoid of the peritoneum, and this happens to be related to the supravaginal part of the uterine cervix. It is related to the supravaginal part of the uterine cervix, right? So let me just kind of represent that. So this part, my apologies, this part of the superior surface is devoid of peritoneum. Because the peritoneum covers most of the superior surface, then it folds back along the uterus, and therefore a part of the superior surface of the bladder does not have any covering of peritoneum. Alright, now let's talk about some other stuff. Now the peritoneum from the superior surface, still talking about a female, is reflected in the isthmus of the uterus to form the vesico-uterine pouch. Over here they have mentioned the vesico-uterine pouch. You can even quite see it, and that is why the part of the superior surface near the posterior border is not related to the peritoneum. Talking about the infralateral surfaces, these do not have peritoneum. The infralateral surfaces are devoid of peritoneum, unlike the superior surface, and they're separated from each other anteriorly by the anterior border and from the superior surface by the lateral borders. This is easy. You can see the infralateral surface. Let me just use this again. This is the infralateral surface. This is separated from this superior surface by this border over here, known as the lateral border, right? And similarly, this infralateral surface happens to be separated from the other infralateral surface by this border over here, known as the anterior border. Now let's talk about the relations. They're different in the male and in the female, In the male, each infralateral surface on the right and on the left is related to the pubis. That does make sense because we have the pubis on either side, so it would make sense that the infralateral surfaces would be related to the pubis. This is the pubis bone, and in between the pubis bone we have the joint, the pubic symphysis, right? And there are also ligaments, the puboprostatic ligaments, right, between the prostate and the pubis. There's also retropubic fat, right? And there's also the levator ani and the obturator internus. Let me find some interesting images. Over here you can see an overhead view of the urinary bladder. You can see the pubic symphysis, right? You can see the tendinous arch of the levator ani, and that makes it easy for you to understand that the infralateral surfaces of the urinary bladder is in fact related to the levator ani and also to the obturator internus. And you can see this is the obturator fascia over the obturator internus. So in the male, the infralateral surfaces are related to the pubis, first of all, which is a part of the hip bone, right? Is a part of the hip bone. So related to the pubis, related to the various ligaments, the puboprostatic ligaments, to the retropubic fat, to the levator ani, my apologies, to the levator ani, and to the obturator internus with the obturator fascia. In the female, the relations are the same, except instead of the puboprostatic ligaments, in the female there are the pubovesical ligaments, because the female does not have the prostate. So the same ligaments, instead of being attached to the prostate below the bladder, are attached onto the surface of the bladder itself.